right, so we're looking at our fetal pig here and the structures you need to know for the fetal pig. When you open up their mouth here to start, you can see the hard palate right along here. Then further back is the soft palate where it's no longer ridged. And then all the way in the back, you should also be aware of where the epiglottis is. And that is that little bit of tissue there. My pointer's on. This guy's the epiglottis, and that's the covering for the trachea. Moving down, we also have, opening up the chest here and looking at some of the structures, you want to be familiar with the thymus, which is right here. It's right on top of the heart. It extends up into the neck a little bit as well. This is that gland that's only present in young animals. And then further down, as we come down, you can see the separation here with the diaphragm between the chest cavity and the abdominal cavity. And our way down, the big blue structure here is going to be our liver. And then we have our umbilical cord right along here. Kind of move that umbilical cord a little bit. You can see the ductus venosus, this vessel right here that's going up into the liver. And that comes up through the umbilical cord to create the umbilical vein. But right here we have the ductus venosus, important to remember that one. On the other side of the umbilical cord, we have the red or pink tubes here. That's the umbilical artery. And there's two of them, and they're on each side of the middle part here, which is the urinary bladder. The urinary bladder, as it comes up here and starts to exit the umbilical cord, it becomes the urachus. It's unique to the fetal structure, and that's how urinary waste leaves the fetus. Another unique thing about the pig and the fetal pig is their colon. They have a unique colon where it's coiled. Let's get him out here. This little guy right here is our coiled colon. It's unique to the pig. Another part that's a little bit difficult for us to see on our fetal pig, but you should be aware of, is some of the fetal heart structures. We had the ductus arteriosus, which was that connection in the heart where the pulmonary artery attaches to the aorta so that blood doesn't need to always go to the lungs since they are in utero and not breathing. But that hole tends to close up after they take their first breath, so that lungs do get all of the blood eventually to oxygenate it. So that pretty much sums up what you need to know here about the fetal pig.